Oh,
We've got a new little consent to recording, so yeah, please do. And of course, we make it available for people afterwards. So I'm just going to start my slideshow. So as you know, we're in step 3 at the moment of the government's roadmap, and step 4 is due to begin on June the 21st. Although I think it would probably be wise for us to talk about that with caution, and we'll come to that in just a moment. So a little reminder, first of all, of the basis for the roadmap. So these are the criteria that are being looked at each time we move to a new stage. And the government have said that they will be reviewing the current roadmap on the 14th of June. So we should know on the 14th of June whether we're moving ahead as expected or whether there will be any delay. The government's decision will be based on the 4 tests, and at the moment, the increase in infection rates and the impact that might be having on hospital admissions is probably going to be one of the biggest criteria, along with the new variant that we're aware of, the Delta variant, which is currently the most common most common COVID variant that we have in the country at the moment. So this is the step that we're currently on, step 3. This started on the 17th of May. Many of you may already be in the process of reopening and following these guidelines. And I would say that these are the guidelines that you need to hold most dear to you at the moment. So any plans that you have got for after June the 21st, I would still bear these in mind. We know that if we reduce capacity, well, we know that if we've got good spacing between people, that we are going to reduce the chances of infection in other people. So I would still keep these in mind as we move forward through June. So step 4, the original aim was to remove all legal limits on social contact. So we would be able to have outdoor events with as many people as we wanted. Dancing would be permitted indoors, and all restrictions on numbers would be reduced and would be abolished. I think it's probably fair to say that there will be some form of extension. The Times were reporting between 2 weeks and a month. I don't think that we'll see restrictions go on beyond the school holidays, but I do think that it is possible that we will see a delay to the 21st. And if you are making plans for after the 21st, I would bear that in mind. It's probably caution. It would be the watchword really as we move forward. And remember that just because all restrictions might be lifted, either on the 21st of June or soon afterwards, that we still need to carry on doing some of the things that have been so essential to reducing the spread. So hands, face, space, for example, making sure that places are well ventilated, meeting outdoors if we can, making the most of the good weather, and people getting vaccinated when they're offered, when their turn has come. We know that by doing that, continuing to test where there are close contact situations is going to be the way that we're probably going to prevent or at least reduce the likelihood of having any further incidents, particularly as we move into the winter of this year, when we'll move into risk areas for normal flus. There's a lot of evidence to show that incidents of flu were greatly reduced this year. And as far as the latest data that I read, we don't have an incident of flu-related death this year. And that's completely down to the wearing of masks, hands, face, and space. So it shows that it does work and it does keep contamination down. So these are things that moving forward we need to think about. Keeping hand sanitizers in our venues, making sure that we have got robust cleaning schedules in place, and using funding that is available to make sure that you're able to implement those moving forward. This is not something that's going to go away suddenly. There's no switch that's going to be turned. And what we want to do is try and reduce the impact on our lives as much as possible. And one of the best ways to do that is to have really, really good hygiene and risk assessment regulations in place. So when talking about reopening, be cautious. Don't stop it from making plans. Don't let COVID get in the way of your plans, but do make sure that you've got delays built in. If you are planning big events and they're dependent upon there being no COVID restrictions in place, then what will you do if there are still restrictions? And of course, if you put good plans in place, you won't have to cancel. You'll just have to change the way that you're set up, introducing different entrances and exits, allowing there to be a thoroughfare or a walkway through an event so that people are travelling in the same direction, causing less chance of mingling or congestion. So think about how you can inbuild either delays into your plans or contingencies so that if the restrictions aren't lifted, you can still go ahead, which is what everybody wishes will happen. We've produced quite a few resources, and we've also supporting resources from the likes of ACRE and from the Health and Safety Executive. So do visit our website, do have a look at the resources that we've made available. And the resources that previously were made available around reopening are still valid. Those checks and the balances and the risk assessment forms, they're all still perfectly appropriate for now. If you are running a community building, there are things that you can do that can minimise transmission. Jo did an excellent session on reopening of community buildings, and this is a slide completely stolen from her training, but it's a really good one just to show the things that people can do to minimise that transition. Keeping good spaces between people, making sure that we're allowing good ventilation, that we're not crowding in particular areas. So there are things that you can do to just manage moving forward, reducing the likelihood of transmission or minimizing it. I've left this slide from previous sessions, which has just got all the reopening guidance, because I know for some of you, if you have been closed and you're just coming to the point of reopening, it's quite useful to have them in one place. So these will be available on the slide deck. If you are running events, it is really, really important that you emphasize to people that they shouldn't be attending your events if they have received a positive COVID result, if they're required to self-isolate or they've got any symptoms. It's really important that we keep messaging that to remind people that if they are symptomatic or if they've tested positive, or if actually they should be removing themselves by self-isolating, they shouldn't be attending events where other people are. And we need to be doing some of that prompting to remind people. We still need to use the QR codes. They still need to be accessible. If you haven't created your own QR poster, the link is there. And it is important for making sure that we don't limit access for people, that people feel comfortable being able to sign in. So it's not something necessarily people have got to ask for, but it's readily accessible. That way people without smartphones don't feel that somehow they're being marginalised or that they're having to do something different. And of course, anybody can choose to sign in rather than use the QR code. That's fine. So support available. These are courses that we've been promoting for a little while now. They are still available and it's definitely worth having a look at. It can obviously be inbuilt into anybody's continuing professional development. So keeping a log of the training that you do is really useful. If you may be seeking employment, these can be incredibly good courses to show your awareness of other people. Particularly the mental health and wellbeing courses. But even if you are retired and you're volunteering, increasing your awareness of the needs of your community is a great thing to do. And these courses are really good, and I've had really good feedback from them. Little reminder that the job retention scheme is still live, is still running. You need to have been employed before the 30th of October because that's when the new tranche of furlough began. So you need to have been employed before then. And it will run until the end of September 2021. There's also been an extension of the self-employment income support scheme, and there is financial support available for people who might be off sick because of COVID. I just wanted to do a little plug for the Restart grant. So this was introduced back in April. Village halls, scout huts, cadet huts, all that kind of thing, they are all eligible to apply. You don't need to have paid rates on your building, just be a business that would be eligible. So if you're getting rural rate relief or you're getting charitable tax relief, it doesn't matter, you can still apply. Now, for many people, they will have received it automatically based on the previous grants that they will have applied for. if you haven't received it, it is worth applying if you're an eligible business. So if you're a village hall, scout hut, cadet hut, anything like that, then you are an eligible business. If you're unsure if you are, just click on the eligible business link and that will take you to the list of businesses that are eligible so that you can find out whether you fall under leisure or retail. And the link at the bottom is the one that will take you to where you apply. It's a simple application process. All you need to do is explain how your business has been affected by COVID-19. That's all you need to do. So an impact on your income is all you really need to demonstrate. If you've received it automatically, there's no point in reapplying. You've received it. But just for some people who may not have been eligible for previous rounds or for whatever reason have not received it automatically, it is worth an application. So that's particularly important for anyone who received the discretionary element of the grant rather than the straightforward retail hospitality and leisure grant. So one of the things I wanted to just sort of touch on today, or rather a couple of things that we're going to touch on today, are new services and changes to our current service that we offer at DCA. And as part of that, I wanted to touch on a really significant part of COVID-19, because it's something that I don't want us to forget as we move into talking about removing all restrictions or moving on from COVID-19 or kind of our new normal or all of that kind of language. And that is that some people in our community have been disproportionately affected by COVID-19. And it's had quite a big impact on people for a variety of different reasons. There is quite a lot of research that's going on at the moment looking at health inequalities in relation to COVID-19, and we're involved in part of a project that's been run by NHS England, and we're doing that in partnership with Community Action Network, which is our sister organisation in Bournemouth, Christchurch and Poole. And we're going to be sort of digging down really into what the barriers have been for people in accessing preventative medicine and also information around COVID-19, and in what ways they've perhaps not felt as supported as they would like to have during this pandemic. In order to do that, we need to listen to those unheard voices, the people that don't necessarily put themselves forward to come and seek out to talk to the NHS, their GP, Health Watch, Dorset Advocacy, don't necessarily put themselves forward to come and get that level of support. And so we're going to be reaching out to groups within our community that support some of the people that have been hardest hit by COVID-19 to see if we can actually get some of those unheard voices heard. Because if we want to do things differently, then we need to listen and learn. Less talking on our part, more listening to those people to find out what their experiences are, learn from them, and then act differently. So when we talk about some of the groups that have been disproportionately affected, the three sort of main ones really that we're focusing on is firstly are people with learning disability. Now, from a study that was done, which is highlighted in blue for anybody who's interested in looking at it, it was highlighted that over four times more likely to have died as a result of COVID than the general population. That figure in itself is quite shocking. But as not all deaths of people with learning disabilities fall onto the registers that were looked at as part of the study, they actually estimate that it's probably over 6 times higher. Now, that's a shocking statement. We know that for some people who live in a more residential environment, they've had some of the similar issues that they had in care homes. Also, testing wasn't brought in as quickly for support workers as it was for care workers. And as a vaccination group, the take-up has not been as high as it has for care workers. And that's still not been perhaps as high as we would have liked. So we know there are a multitude of reasons why this might be, but underlying that is the simple fact that life expectancy is lower for people with learning disability. They already have health inequalities when it comes to comorbidities, so conditions that they might have. And COVID has just been something else that's affected them. And we need to start looking at how we can improve our preventative health for people with learning disabilities, particularly within that younger age group. As I say, it's bad enough when you look at a 6 times higher. When you break the age groups down to the 18s to, I think that says 34, it's actually 30 times higher. So within the younger age group of people with learning disabilities, we've seen an even more disproportionate effect. It probably has something to do with the fact that they're more likely to be out and about in the community, and so more likely to have come into contact. But again, it does show that we need to know more about why people with learning disabilities have been so affected and what we can do to support them better. Everybody with a learning disability is entitled to an annual health check. And in the Southwest, it runs at about 25% of those who are eligible receive that health check. So again, we need to look very closely at why it is that one of the main ways that we can bring in preventative measures to keep people well is not being used. There's something not quite right with the messaging. We need to act differently. And we hope that through our research and talking to people who don't normally get the opportunity to speak about these things, including their carers, we'll have some better insight into how we can act differently, particularly around COVID-19 vaccination. Another group that have been disproportionately affected that have perhaps had just slightly more media attention has been around different ethnicities. And we can see that males of Black African ethnic backgrounds have a much higher death rate, about nearly 3 times higher than males, with all the factors of age and everything else taken into consideration. So you can see by the chart here, I know that the writing is very pale. I'm afraid it was taken directly from the Office of National Statistics website. But Bangladesh and Black African males definitely the highest disproportionately affected. And then for women, we're seeing Black Caribbean as being even higher within that community. So we've begun looking at, there have been several reports that have looked at why this might be the case, but what we need is really some again unheard voices to be able to tell us why it is that they feel their community has been particularly affected, how the messaging has worked in those communities. And we're part of a project already called Trusted Voices, which is looking at creating exactly that, trusted voices within the community to help with health messaging, to make sure that we're myth busting, and also to make sure that accurate information is reaching the people that need it most. Public Health Dorset have also done an awful lot of work in making sure that testing and vaccinations have been made available at sites that are appropriate for people that may have some hesitancy around vaccinations. So a lot of work is being done, but again, we're still not sure why a lot of the preventative messages are not getting across. And also why the take up for a lot of preventative things, again, like health checks, are not being taken up. So further work still needs to be done. And the final group is those with severe mental illness. There's been less research done in this area, and also because of the comorbidity. So, again, those multiple things that might be linked to somebody having severe mental illness, such as a greater likelihood of smoking, a greater likelihood of being obese, a greater likelihood of diabetes. They fall into lots of different sections within the statistical analysis. So sometimes it can be quite hard to unpick. But a really good piece of research that was done and was posted in the Lancet just recently estimates about 2 to 3 times higher mortality rate for people with a severe mental illness compared to the general population. So again, significantly higher. We also know that if they get COVID-19, they're more likely to be hospitalised. So even if it doesn't result in death, the impact is likely to be more severe. And people in psychiatric institutions have also been greatly affected, as have other people in residential care. So although we've got long-term lessons to learn, we also need to look at things like our vaccine uptake. If these people are being more disproportionately affected by COVID, then the main protection that we have at the moment is vaccination. So what we're seeing is that some of these groups are also disproportionately more likely to be vaccine confidence hesitant when it comes to actually having the vaccination. So again, these figures mean that we should be looking very closely at how we support people. Probably the one that I came across fairly recently from the Office of National Statistics was around disabled adults being more worried about the effect on existing health conditions of having the vaccination. And that, of course, is going to create great hesitancy in whether you have it. If you think it might mix badly with your medication or it might exacerbate a current health condition that you've got, you're going to be very reluctant to have it. And so one of the messages, for example, that all of us can take away and make sure that we share with people is that everybody is entitled to speak to their GP about vaccination. That's something you're entitled to do if you want to talk to a health professional about how it might affect your particular condition. That's something you can do. People with severe mental illness can have a completely separate experience around vaccination than anybody else. They can be done individually. They can have a separate room that they can go to if they have needle phobia or any associated difficulties around being with crowds, anything that really might get in the way of them receiving their vaccination. They're completely entitled to support, and they can get that through their mental health services. But many people don't know they're entitled to that. We've also got a situation where a large number of people with mental health issues are worried that their current medication will have an impact with vaccination. And current guidance says that actually there's very few medications that have any kind of effect alongside the vaccine. So actually it's incredibly rare that a medication will have a problem. And if you go to have your vaccination, one of the things they ask you is about current medication you're on. So the advice is make sure you take a list with you of current medication you're on, and that way it can be cross-referenced. There are, of course, exceptions. There are, of course, drugs that don't work particularly well with the vaccine, can cause increased risk of side effects. So again, if you're on medications and that's causing you some reluctance, then speak to your doctor. Go to your doctor. They know your health better than anybody else and will be able to advise you. But these are the kind of issues that we hope to look at in our study. And really, we'd love any of you to get involved at all. So if you support a group that you think would be interested in being involved in this, then we would really love to hear from you. And you can email me or you can go through our info at and we'll get back in touch with you. And we probably will be reaching out to our members and our subscribers to see if people would like to get involved in the project. And we do have some small grants that we can give to groups just to support them in the telephone calls or the time it might take just to find out if people are interested. So do approach us, because the only way that we'll change some of this health inequality is by listening and learning and acting differently. That's our armor. That's the thing that will level up people's health, and we'll see that things like this don't continue moving forward. So my final little reminder is just of our hands, face and space, and not forgetting fresh air. So do it for Dorset. At this point, talking about doing things differently, I'm going to hand over to Caro Hart. Caro Hart may be a new member of our team for many of you. She joined us, oh my goodness, weeks. I think we're still counting in weeks, Caro. So I'm just going to stop sharing. Joined us weeks ago and is taking a lead on our training and also the consultancy that we do for people in the community.
Thank you, Paula.
I'm going to hand over to you.
Before I start, Paula, there's a few questions coming on the chat, which I don't know if you wanted to just cover those briefly before we move on.
I'll have a little look at them, Caro, while you're talking, and I'll put responses up as I can.
Lovely, cool.
Thanks.
Right. Good morning, everybody. Let me just do the wonderful thing with the sharing of the screen. Bear with me. There we go. This is death by technology, isn't it? Let me just try that one again. No. Typical, isn't it? Just when you're ready. Can you roughly see that view? I'm afraid we're going to have to make do with that. Yes, I am, as Paula said, Caro Hart. I've been involved with DCA since the beginning of May. And it's been a whirlwind few weeks, as you might imagine. I've joined at a time when there's a lot going on for our members and a lot going on in the organisation itself. this is roughly what my remit is. It is split between consultancy services. You may be familiar with our strength reviews and health checks, and also to do bespoke consultancy. So working with other team members to pick up both the quick and easy queries you have, but also the long-term projects that you want support with. And that could be anything from developing new services, working with staff and trustees, down to the dreaded task of updating your policies and everything in between. The other thing that I should be doing is the courses and workshops and training. And we have an ambition over the next months, years, to create, to pull together all of the good training we do and have done into what we're calling a training academy. And there'll be more information of that a little later on. So I'm going to try and do the next slide. No, sorry. I will try and.
Caro, does Ray have a copy of your slides?
She does.
Ray, would you like to try sharing?
Oops, sorry.
Sometimes that's the best way to do it. Thank you. Just bear with us.
Sorry. Anyway, I'll carry on. We said about the doing things differently. We're already rolling out some of the new materials. We're looking at trustee training, which is on the 16th of next month. There we go. Right, could we have the next slide, please? That's how it's supposed to look. We're looking at trustee recruitment, induction and diversity first of all, because when I arrived and I started talking to people, this was the burning issue for a lot of you. That trustees perhaps have had other concerns, have dropped out. And by trustees, I also mean people in management and steering groups as well, for those of you not formally constituted. And that's going to make a big difference going forward as you recover to what can be accomplished. So on the 16th of June, we're doing a training, a workshop on how to recruit trustees, thinking about diversity and going back to what Paul has just said about, for instance, health inequality. The sort of work that you're doing might be you want to involve users, or you might want to involve people who've particularly been affected by COVID in the work you're going to be doing going forward. In a very similar vein, and looking ahead for the future, at the end of this month, we're going to launch some taster training sessions. So short, sharp, very practical sessions. They're all in the morning, and you can come to one or all of them as you choose. The first one is very much what I've heard from people, is about telling the stories, both the stories of what you've achieved generally, but particularly the stories of the last year or so, because you have accomplished the most amazing things as a sector in Dorset. And quite often those are things that you didn't expect to happen. I mean, I've heard stories of organisations within a few days of the initial lockdown in March, creating whole new services online, reaching out to new people, as well as the amazing work that small local community groups have achieved with collecting prescriptions, supporting people who were self-isolating and so on. And that is those stories, those accomplishments are things that are going to be really important going forward. Particularly, I have to say, in an environment where funding is going to be far harder to come by, those organizations who can really show the impact of what they've done, tell their stories, will have an advantage. And as we've said, as Paul has said, there is planning to do, whether it's for having contingency plans for if we move to the next stage in July or June or whenever, or whether it's to consolidate changes to services, to just having Zoom meetings for trustees and things like that. There is a task facing organisations to plan for that and to consolidate that gain. Also, a lot of organisations are finding, actually, with the restarting, you're finding that there's new people getting involved in your services. It could be that you are reaching people you didn't have a chance to reach before because you've got an online offer, or because more people have become unemployed, or for a number of reasons. So actually, horrible term, marketing your services is going to be very important. There's also an element here about managing expectation, because you could be one of the organizations who's going to be absolutely inundated. So it's not about attracting new people, it's about managing the expectations of the people you are working with. So those are the 3 taster sessions. There's going to be lots of templates, giveaways, top tips and things, just to help you to start thinking about some of those things. And both that and the trustee recruitment, induction and diversity are now on Eventbrite for you to book on, and you'll be seeing those through the newsletters in the near future. The other thing I'm very pleased to say is that the trustee club, which was on hold during COVID, is now restarting. And we're restarting with a breakfast meeting. Bring your own breakfast, I'm afraid. I can't post it out to everybody, but that would be nice if I could. On the 14th of July. That will include a briefing on Charity Commission guidance. It will include some free giveaways as well. And but also we'll be asking trustees, management committee members and steering group members, what is it that you need in this brave new world, and looking to develop it accordingly. And as I've mentioned, in the longer term, we want to pull all of the training and courses together under one umbrella. And I've been talking to people as we've done the networking. Some of you may have been involved when we did the poll before. And almost 9 out of 10 people are saying they want a combination of in-person and online for training going forward, because we've all discovered the benefits of nipping in online, but then there are a lot of benefits getting together in person. You can do different things in different ways. So that is the plan so far. And again, I'm going to be asking you until you're sick of me, what is it you want? What is it you need, so that that can be included? Could we have the next slide, please, Ray? And speaking of which, we're now going to launch a little poll. And what I'm going to be asking you, and this is slightly, it's going to be slightly different to what's shown here, is you'll be asked to score 1 to 3 for 4 of these things. So how much would you like to have training and information and materials through live talks, like this with questions into the chat, which we can do, pre-recorded short talks and presentations, which you can look at whenever you like. Maybe that particularly lends itself to shorter information-based stuff. Also looking at interactive live workshops, so where you get into little groups and so on. You may have had experience of that. How well does that work for you? 1 is good, 3 you're interested but perhaps not so. And the final thing I'm going to ask you about on the poll is downloadable templates and workbooks. Do those work for you, or are they just another piece of work? I'd also like your thoughts through the chat on small groups working together via Zoom or Teams. If you've come across an action learning set where a small group get together and over a series of weeks, you work together to give peer support on real life problems that you are individually going through. We could do something like that. And also peer support networking meetings, where you support each other. So if you have any thoughts on those two, Ray, could we launch the poll, please? Lovely. So if you could just, yes, this is a priority 1 down to 3, which is not sure if it's needed at the moment, then I'd be most grateful. I'll just give you a few minutes to do that. Thanks, Patricia. So all of the above then.
While people are filling that in, I just thought it might be useful for you to hear some reflections about doing these kind of polls. We've actually found that as an organisation that does quite big surveys, as you know, our State of the Sector survey, which we've just recently been doing, we have found these kind of things really invaluable. They're quick and easy to arrange. There's lots of resources out there. Another good one is Smart Survey, which is quite good online. But actually things like this that you put up on the door of your organization and ask people to pop a sticker next to their preferred choice, it's a really, really, really great way to have evidence of need for a funding bid. It can be really good as well to give direction to your trustees if you're unsure what your priorities might be. So I actually can't recommend this kind of thing enough. It's so, so useful to have snap quick polls that you can use as evidence. So so thank you for taking part in ours, but do think about them for your own organisation. So sorry, Caro, I'll back out again now.
I think that's a brilliant idea, and I've successfully used the smiley stickers idea with beneficiaries on several projects. So that's really all I have to say. Could we go back to the first slide, please, Ray? If you've got a hand free. So,
should we end the polling there, Ray? I think.
Yeah, that's cool. In which case, what I shall do is add in the chat my email. So if anybody's got any questions or any observations, I'm quite happy to, oh, here we go, right back to the beginning. And my email is just at the bottom there, you see. If you want to take a note of it and come with any questions or observations, most grateful. Okay, thank you very much.
Thank you, Caro. If you've still got the poll up on your screen, you just need to close it. I know sometimes you can feel a bit reluctant to do that because you think you're going to shut something down for someone, but it's fine. So if it's there, please do just close that down off your screen. Thank you very much for taking part in that. So as part of what Caro was talking about, which is us doing things differently, we've been really lucky to receive a little bit of extra money from Dorset Council to support the new and emerging COVID-19 response groups and also our village halls. And this is in recognition that as we move out of COVID-19 restrictions, there's going to need to be changes in the way that these things operate. So if you've been part of the COVID-19 response, you might have a sense of your work is coming to an end. And Dorset's response to that is, no, it isn't. Please don't go away, because actually what we've discovered is just how fantastic neighbourhood support really is, and how we want to continue having that level of support and that level of contact. Some COVID-19 response groups are going to be standing down, but have said voluntarily that they're happy to remain as a communication channel to help put notices up locally, to check on neighbours. So in a wide, vast range of ways, the COVID-19 response that we've had, we want to keep some of that energy alive. And so this will be an opportunity to do that. It's going to be led by Joe, many of you will know. So Joe will be making contact with, hello Joe, we'll be making contact with many of you to talk about what that could look like for you and what support we can offer. For the village halls, for many of you opening up, you're going to find that there's differences and there's changes, either in what you need to offer, how you go about doing your daily business, and actually getting customers back through the door. We're already hearing that some of the people that were shielding are reluctant or concerned about coming back out into the community. And of course, that's the last thing we want. So we want to see how we can put together a supported offer that encourages people back, how we get some of the things started that have closed down, such as community lunches, and how we can restart those and actually map them better so that people can access them more easily. We know that we've got an opportunity to create village digital hubs to have access to digital services at a local level for people that don't currently have access to them. And we know that the village hall network could be a fantastic way of doing that. So that's one of the key areas for us. So Joe will be making contact with subscribers and members who fall into those groups, but also don't hesitate to make contact with us. And I'm going to hand over to Joe in just a second to talk through the ways in which to contact us. But just remember, what we will definitely be able to do is support you. Now, that'll either be through direct support, so we'll be able to work with you one-to-one to help you to be able to get your village hall restarted, to build your business, to diversify your business, and if you're a COVID-19 group, how you can still have an offer, even though many of you may have gone back to work or may not have the availability that you did before. We can also help you through signposting, training, networking. So there are lots of ways in which we can support your group to access funding opportunities, to link you up with Caro to be able to look at additional support, maybe looking at strength reviews, maybe looking at where there may be gaps in your current provision or your current governance. We know that trustee recruitment is going to be a biggie across the board for all our charities, which is why we've made it a priority for our training to look at that and to look at how we can support you to recruit trustees. And also, we have to remember we've got over 2,000 people that have registered to volunteer through this COVID response. We need to do some work as well to support those volunteers to see how they can be part of the solution too, how they can be a trustee for the future. So you've heard all the exciting things that we hope to offer. I'm going to hand you over to Joe, who'll talk about how you can get in contact with her.
Right, can you see that? Yep, excellent. Okay. So continuing on from what Paul has said about the support for groups and village halls to reopen and to continue operating as well, we've got the helpline, which I know many of you have taken advantage of over the last year or so. It started with my number, then it went over to Julie's number when I was doing other projects, but it's now come back to me. So please make a note that the new number which is on this slide, the 01202 847 609 is the new number for the Tuesday afternoons. It may be that if we find that lots of you are calling on Tuesday afternoon, we may end up with opening some other time slots as well. On the 23rd of June, Julie Wigg and myself will be doing a webinar, and we'll be talking about reopening support and continuing support for groups and village halls. So please come along to that. And you might wonder why I've got multiple email addresses at the bottom. It's because we've found when we are sending out information to you that sometimes we're sending it and we're finding that you're receiving it several times over, because we are using all the email addresses that you've given to us over time. So if you know that you've got lots and lots of email addresses and you would prefer it just to go to one, it'd be really, really nice if you get in touch with us so that we can take off the ones that you don't feel are really in use anymore. Gives us an opportunity to clean up our database as well. And the other slide just wanted to show you was, there we go. These are my contact details. So if there's any issues that you have with continuing, starting up, moving on, whatever it is that you want to do with your group, village hall, my contact details are here. So you know I'm Jo Keats. There's my email address. Telephone number is exactly the same as for the helpline on Tuesday afternoons. And the website is there as well if you want to go to the request an advisor. But I will be in touch with you all soon, because I want to get in touch just to sort of find out, do a sort of little mini health check with you to find out how you're getting on and what it is that you want to do for the future, and to see what support we can offer you. So I look forward to hearing from you soon, and please, I apologise if I do end up sending you several emails at once because of your multiple emails. Thank you.
Sorry, my my mute didn't want to unmute. Thank you, Jo. That's really useful. And remember, all of the slides will be available, so all of the contact details you'll be able to access then. So just in our last few minutes before we finish, I'd just like to share with you some funding. So Ray, if you could give me a thumbs up when you can see that, that would be great. Lovely. Thank you. So the difficulty I always have is now moving the toolbars so that I can read what I need to be able to read. So we've got the Arts Council England Cultural Development Fund, and this is the second round. The deadlines for this are 23rd of July, so there's quite a bit of time to be able to look at it. These are capital grants, quite large ones, so they're looking for partnerships. Groundwork funding is still available for the Dorset area. We're being told that this is a really good time to apply, particularly for Dorset. So there's a good chance of being successful. You've got till the 14th of June to be able to apply. You have to have your application submitted by then. Sorry, the 21st of June, forgive me, 21st of June, but if you can get it in before the 14th of June, they have promised that they will look over applications that aren't quite strong enough and will get them back to you in time that you can resubmit them. So that's the 21st of June is the deadline, but we recommend aiming for the 14th, which of course is very soon. The Poundland Foundation grants up to 750 for local sports and charitable organisations, and you've got till the 30th of June for that one. I'm looking at the Devon Community Foundation. You can see that wasn't put on by me, but I'm assuming that that covers the Southwest, but I probably would want to check that. Joe's nodding at me, so yes, it must include the Southwest. So obviously quite useful. one to apply for, because actually I would imagine they won't get that many applications from Dorset. So that will make you stand out. So that's really good. Matthew Good Foundation, not-for-profit organisations. These are particularly good for small organisations, which means that they will also have their applications set up that way. So it makes it much easier to apply. 15th of June though for that one. And we've got the Radcliffe Trust as well, which is cultural heritage and craft projects. Again, they're not large grants, but they're really good, particularly if you're starting up a new project that you've kind of had mothballed perhaps for the last year. Bit of a whistle-stop tour. All of these are available through our funding page on our website, so you can access them, and they all have direct links to take you to the fund. If you are a member, of course, it's worth me, I'll just stop sharing. If you are a member, it is worth me saying that you will receive a fortnightly funding update. So as well as the e-news that you currently receive, you would also be able to receive our funding update, which goes through all the latest funding. So there can be often about 15 different funders that are being shown there. And what I would say is that Julie, our community advisor, spends a lot of time going through for the ones that are most relevant for our groups, and also highlighting those, like that with Groundworks, where we've been given information to say that it's a really good opportunity for Dorset residents to apply. So it's not just getting a simple way to access funding alerts, but also to get some guidance on the ones that should be applied to. We do also add in news from our local partners as well into that funding update. So it's quite good to find out what's going on through Health Service and through the local council. So a little plug for our membership there. Remember, at £25 a year, we're a bargain. Thanks a lot for coming today. It's been really, really great. Please do make use of the telephone numbers that Joe supplied. If you are a village hall and you would like to have some targeted supports, don't wait for Joe to contact you. Get in contact with Joe now. If, on the other hand, you want to wait to find out exactly what the offer is and see whether there's particular things that might be of interest, there will be emails coming out very shortly. So thank you again, and look forward to seeing you all very, very soon. Thank you. Bye-bye all.